It's the week of January 10th, and this is COVID Conversations, where we discuss the latest COVID-19 news with the experts. COVID-19 positivity rates in Massachusetts have reached critical heights over the past 7 days. Hospital experts continue to urge people to stay home if feeling ill, avoid large gatherings, wear a mask, and stay at least 6 feet apart to prevent the transmission of COVID-19. Mark Gendreau is the Chief Medical Officer for Beverly Hospital, and he joins me now. Today's question is, did the holidays contribute to this current surge in coronavirus cases? Dr. Gendreau, welcome.
Thank you.
So if you want, tell me, did the holidays contribute to the current surge in coronavirus cases?
It did, as we were, a lot of people who follow the media, Dr. Fauci has coined the term the surge upon the surge back in Thanksgiving, when he was warning that, we were going to see an increase in cases from Thanksgiving and then again in Christmas. And, indeed, we saw a surge upon a surge upon a surge here in the state of Massachusetts. We did see a pretty good ramp up in the week after Christmas, which put a lot of strain on hospitals.
One of the things we keep hearing, especially now that we are rounding almost on a year of dealing with this virus, is this idea of pandemic fatigue. People being tired of being home, people wanting to be with their families, especially around the holidays, people deciding to travel. How do we tell people to keep fighting this good fight for the long term?
Yeah, it is very challenging. COVID fatigue is real. COVID fatigue is very real in healthcare workers. We have to keep in mind of the success of, like, New Zealand, for example. They've declared themselves fully free of COVID disease, and that's even without vaccination. And we can do the same. We just have to adhere to, the three principles of wearing a mask, keeping socially distanced, and carrying out good hand hygiene, and really thinking through when we get invited to parties, whether or not this is a really good idea. Because what we do know about COVID infection is that you're not as much to likely catch it, being out in school, for example, or in the hospital. You're more likely to catch it in very small groups of people and really have your guard down. So these little small get-togethers at home or whatnot can be very problematic.
Well, I think an argument that I have heard online is, if you can go to the grocery store, then you can also do this. If you're going to be at the grocery store for an hour, you could be just as exposed as if you were at a party, as if you were at the gym. Do you think that argument lines up, or what would you say to folks who say that?
I would say a couple of things. Number one, your guard is down. You're probably, psychologically thinking that this is not as risky as being in the grocery store. So you're more on alert when you're in the grocery store. The second is just the space that you're in. It's bigger, it's more open. If you're in your small space, say a living room or whatnot, where ventilation may not be as robust as it is within, a larger building, such as a grocery store, a large office space, or a school, you're not going to have as much circulation, in your living room as in that public space.
Right. So I think one of the, some of the key takeaways from this is that we really have to adhere to those core principles of wearing a mask, staying apart, washing our hands, and know that our amazing healthcare workers are working really hard and they're tired. So by doing those things, we can also give them a little relief, as well as our families and the people that we love.
Yes.
Thank you so much, Dr. Gendreau. It's a pleasure to have you here. This is COVID Conversations, where we discuss the latest COVID-19 news with the experts. Thank you.
Thank you.